Namaskar and howdy. It's been a long time. I've been very busy once again, especially starting this new job. So apologies for the delay. If any of you are watching or wondering what's going on, I'll talk more about the job in a future video. But yeah, good things. It's just really busy, a lot of moving parts and handing off the old, goals and ventures that I had with starting a clinic with those colleagues and friends, and then starting this new job. So just very busy, but again, good things, good things. So today I wanted to talk about why you shouldn't try to like cheat the provider, the healthcare provider, into getting a certain diagnosis or certain treatment like prescriptions, because in the end you're just cheating yourself, and it can be very dangerous too. So I'm reminded that there, not all, but there are people out there that are seeking a diagnosis and usually some kind of treatment like a prescription drug, right? Usually a controlled medication like a stimulant or an opioid. Not all, but there are certain things that are, as an adult, you've learned to live with certain things like ADHD, if you truly have it. And then there are things that look like ADHD, but really it's more boiling down to like stress or some adjusting to some change in your life or some incident, maybe PTSD as well. So, and that takes a while to suss out, and usually it takes like testing or seeing a psychologist who will do a lot of very specific tests and evaluations to help determine whether or not you do, in fact, have ADHD and you've just gone undiagnosed pretty much your whole life. So that does occur for sure. But I, again, want to urge people, don't do that. Don't try to, nowadays it's so easy to, get on groups on Facebook or social media or even use AI chatbots to see what are the symptoms, what are providers like doctors, nurse practitioners, PAs, therapists, psychologists, what are they looking for so that I can get this diagnosis and therefore get, XYZ prescription or treatment. And they'll say the right things and they'll behave the right way, to the right way, meaning to get that diagnosis and that treatment. And the reason why that can be dangerous is because if you don't, with certain things, if you don't have that disease or disorder, and you're taking medications that are unnecessary sometimes, and you're not being truthful about all the other history that you may have or family history, we can make things worse that you didn't even know you had. And I'm thinking a lot of times, people that have like maybe undiagnosed bipolar disorder or some kind of psychotic disorder like schizophrenia, or like if you're seeking opioids and stuff, that's a very dangerous game. So, you just got to be very careful with that, because you may have like a family history of cardiovascular diseases, and this goes with stimulants too, where it can make that worse, or it will become known to you once you start taking these medications. And then the other reason is you're just cheating yourself. You're not getting to the root problem. And a lot of people just, hey, I just want a Band-Aid. I just want to have something to get me through. But you just keep kicking the can down the road further and further. And I've said that before many times. Like, at some point, we got to face things and we got to pay the piper, right? With certain diagnoses and treatments and prescriptions, you could really be making it worse on yourself. So I really suggest like not to do that. Again, it can be dangerous, and two, you're just masking things and you're putting it off, and you're throwing more crap into the garbage bin, and it's busting at the seams, right? It's starting to really stink at some point, and you're going to have to clean it out, right? Effectively, not just, put a blanket over it, hide it, or try to, throw it down a deeper corridor in your mind and your heart. So that's my advice. And it also makes things very difficult for us providers too. Because again, if it's a dangerous situation, well, now we got to deal with that, right? And it's like not boohoo on us, but that's liability for us, right? And then we feel bad because it's like, I just wish they would have been honest with me. Because, like, we do want to help people. Most of us genuinely want to help people. So be honest with us. Like, say, hey, I think I have ADHD, or I'm having problems focusing, or I do have pain, etc. Right? And then just know that it may not be immediate, right? Immediate fixes are like what you see in like the ER, right? Or urgent care. And most of the problems that we have, it seems urgent. There's a sense of urgency or gloom and doom that's just really hanging heavy on us. But that's when we got to go back to recentering, ourselves, regrounding ourselves, right? Using stress reduction techniques, talking it through with somebody. There's lots of crisis hotlines out there and therapists that are looking, for new patients. And then getting the right help, getting you to the right help, right? And getting the right treatments or interventions for you. That's just my tip for today. With this new job, I'm reminded of that. And then also, I would say the last thing, don't try to cheat yourself in the provider, because then you're also cheating a lot of other people out there who legitimately have those problems and need those treatments or medications. And then you start to add to this consensus, like, well, they could just be drug seeking, well, they could just be lying to play me and get a diagnosis, and et cetera, et cetera. And you're just making it harder for other people who legitimately need the help. All right, I'm not trying to say you don't have issues and problems that you need assistance and help with, but let's get the right person and the right treatment to you. So just be honest, just be transparent. That's how we should be anyways with all our dealings, not just healthcare. Anyways, take care, y'all. Talk to you next time.